Hi, welcome to the Fit and Healthy Today show. And this is a continuation of our section on chronic pain. Last week we discussed the causes of chronic pain, which included obviously nightshade vegetables, heavy metal exposure, pesticide chemical exposure, nutrient deficiencies, all those issues. And if you need to, you could review back through our other show, or we have the sheets such as this one at our vitamin and herb stores. But today I wanted to talk about some of the most researched supplements that are available for chronic pain. Now, everything I have listed down here is very well documented, and you could go online and you could look up the research yourself. I've got 2 pages, but I probably could have put about 5 or 6 pages. So I'm probably going to miss some good supplements. Like, for example, I recommend bromelain a lot. It's comes from pineapple, and it's a really good anti-inflammatory. I recommend Cerezymes. A lot of athletes use serapeptase enzymes for athletic inflammation. There's a lot more added to this list, and what happens is I know personally when anybody comes into my store, we kind of evaluate where the inflammatory is coming from and kind of appropriately steer people in the right direction with the appropriate research that's for their specific issues. The ones I mentioned here are probably the most popular and, like I said, the most well-studied ones. Number 1, and this is, you cannot fight inflammation or pain without having adequate nutrients, just the basic vitamins and minerals. And that would include a good multivitamin. And I'm not talking about going to your local warehouse, grabbing the big, huge bottle for $10. And I could list some brands, but I guess I can't do that. With 17 toxic substances in it, and call that your multivitamin. You need a good multiple vitamin high in B vitamins. B vitamins help you kill pain. They also help certain other functions in the body as far as repair and anti-inflammatory. So a good multiple vitamin from a health food store would be my strongest recommendation to you. And you can kind of pick the right one out based upon your stomach sensitivities, or if you want some iron or no iron or food-based. There's a lot of good ones out there, but you're not going to find them in your local supermarket or warehouse. So good multiple vitamin, high in Bs, and if you'd like to, you could supplement along with that. And I've had pharmacists tell this to people for chronic pain: B vitamins, B vitamins, B vitamins. And we know from an athletic standpoint, B vitamins help you metabolize proteins, but they do so many other things. They also actually, if you take them late at night, can keep you awake. So doing a B50 or a B100 in combination with ester C. Now that combination, for some reason, raises a person's ability to deal with pain. That's called a pain threshold. That means how much pain you actually can take. You know, some people have low pain thresholds, some people have high pain thresholds. This combination with the B's and C's raise your pain threshold level to where maybe the pain that was heavy hitting you before won't affect you as much. Basic items used for so many other things. I think that should be number 1 and 2 consideration anytime anybody has any pain and inflammation. Calcium citrate, or bone calcium, it calms down the nervous system, and calcium and other minerals aid the body in alkalizing. Now, remember, we've got acids and we've got alkalines, and most of the time I tell you, eat an alkaline diet. And I think in the series before this, we talked about the diet, the macrobiotic diet, things that alkali the blood. When you alkali the blood, pain drops. So it's necessary to have good quality, and I'm not talking about the limestone at your nearest drugstore called calcium carbonate. Has a poor absorption, and yes, it'll neutralize pH, but there's so much free-floating calcium going to your kidneys and into your joints that will cause you problems further down the road, including digestive issues. So go with a good calcium citrate or a bone calcium source. And mind you, you're going to usually find those once again in a good health food store, in combination with magnesium citrate. Now, we talked about how the average American only gets about 40% of their magnesium needs from their foods now. So that being the case, obviously in this country, because our vegetables are so mineral deficient, we need to have more magnesium. It stops muscle cramping, literally can stop pains of old surgeries. I have had, and I I've had this happen with my customers before, but to read it coming out of some of the university studies on old football injuries from some of these old football players, adding the magnesium in there with the bone spurring that's occurring and the muscle spasms actually can help with old sports injuries. Accidents, arthritis. Now, when your doctor, once again, does your magnesium analysis, he should do a full mineral analysis to make sure that you've got adequate amount of minerals. Because another category in here I would say is trace minerals, and hopefully in your good multivitamin you're getting the additional other minerals such as zinc, copper. Those are all necessary for deflaming and having less pain. D-L-phenylalanine. If there was a magic pill. It raises endorphin levels. Now, endorphin levels are your feel-good hormones that make you all happy, and you usually have them when good things happen in your life or you're a joyful person in that regard as well, too. But exercise also increases endorphin levels. It's a certain neurotransmitter that you release, and it just makes you feel so good. D-L-phenylalanine raises endorphin levels in a natural way. So, I mean, I've used this actually to help get people off of their pain medications because it raises endorphin levels. The pain medications knock off the body's own natural ability to kill off pain, whereas D-L-phenylalanine raises endorphin levels. So this is one way that you can utilize to help in conjunction with your healthcare professional to get you off some of those pain medications. Green lipid sea mussel, and you're probably going, yuck, what is green lipid sea mussel? It does come in a supplement. You don't have to sit there and go look for green lipid sea mussels. But what was interesting about it in the clinical data I came out with, or the studies supported, is it was more effective than ibuprofen. Wow, most doctors are saying, passing out and saying, do your ibuprofen 2-3 times a day. The reason why, and I've got the good explanation down here, it modulates abnormal cell membrane chemistry of pain and inflammation without damaging the digestive tract. And I think, bottom line, since we know that the NSAIDs damage the digestive tract, oh my. Okay, that being the case, you end up with that leaky gut and toxins leaking into the body, chemicals leaking, and you end up with more pain. The NSAIDs just cause this magical cycle to occur of chronic pain and inflammation, whereas something like green lipid sea mussel doesn't do that. Acetylmethylstearate, I never say this right. We call it CMO, actually. And CMO really has a lot of research pertaining to autoimmune and arthritic conditions. The studies that were done on here showed that it was effective in 50% of people for reducing pain that had arthritic, rheumatoid arthritis, and autoimmune actually induced types of arthritis, including, like I said, rheumatoid arthritis. It comes from beef, and you have to kind of know your source of it. There are some vegetarian sources as well. They're not quite as effective. But it kind of lubricates the joints, and as noted in here, it literally does help support membranes. Some good studies out on CMO. You can look that up online. Niacinamide and acetylcysteine. We call it NAC is what we call it. Might help if I spelled it right too. I've got the dosages down on here. We've got 500 milligrams and 200 milligrams twice a day, preferably on an empty stomach. What it does is it aids and abets the detoxification of the body and free radicals that cause pain. And so as you have these free radicals that are causing oxidation and rust in the body, these are niacinamide in a combination with one of the strongest antioxidants known to man, NAC, N-acetylcysteine, substantially reduces the toxin level, and you can throw it out. Niacinamide also has some research on arthritis, which we know, obviously, because of this, and research on Alzheimer's, too. It doesn't cause any flushing, unlike the niacins that sometimes the doctors recommend for cholesterol. Glucosamine chondroitin sulfate. Now, this has recently, for some reason, come under dispute in a lot of commercials. And they're trying to say things are better than glucosamine chondroitin sulfate. And I have to say, there are so many studies that back up this supplement, animal research and human research, because it's been around for a long time. And there were actually graphs scientific graphs that I came across that literally showed 1,500 milligrams, 1,200 milligrams helped rebuild bone, not just cartilage, bone as well, and cartilage tissues for arthritic people. In about 2 to 4 months, you notice a big difference and a reduction in pain. Whereas the NSAIDs, after 2 to 3 months, their inability to kill off pain and reduce inflammation dwindled. So it was like, here we had this, high up, and then all of a sudden you watch it, and the glucosamine, chondroitin, and sulfate zoom up, and the NSAIDs go down. So the only thing is, if you have diabetes, you have to get special sources of glucosamine. There's one source called N-acetylglucosamine that does not affect blood sugars. I think that, I know we have a local doctor in town, Dr. Lindbergh, and that's what he'll put his patients on as well. There is a product called hyaluronic acid as well. And you need to have a fermented source that can lubricate joints. I'm fairly young, and so I don't have any cartilage deterioration, but sometimes we can get a stiffening of the cartilage. And so when the cartilage stiffens, adding a little bit of glucosamine with maybe some of the hyaluronic acid, which is very youthful and all, but it helps with connective tissue, and it pulls moisture into the joints, into the skin, and other places. A lot of anti-aging treatments for the skin with hyaluronic acid too. Probably the most studied herbs that I came across were boswellia and turmeric. And once again, I know Dr. Lindbergh occasionally will recommend putting his patients when they don't want to do the NSAIDs, because a lot of them, like I said, upset your stomach. These are very potent anti-inflammatories and painkillers that have been around for centuries. So they're time-tested versus showing heart valve deterioration and all of that we see with NSAIDs, gut, all those issues. You're not going to find that with boswellia or turmeric. In addition, they're extremely anti-cancer. They're potent antioxidants. So usually when you take turmeric, you're going to take it a little bit with food because it's a spice. It's a turmeric. We use it in food. And so usually do it with a little bit of food. Type 2 chicken collagen. A lot of recent studies have come out about that. And some of the best studies that I found were done on children, particularly children with rheumatoid arthritis. We've seen a real influx of rheumatoid arthritis recently in kids, and we don't know if it's being caused by the vaccines, diet changes, chemicals in the environment. It's probably poor diet. I think it's a combination of all of the above. So the type 2 chicken collagen literally stops the body from attacking itself. And so it's very helpful not only in regular arthritis, but in autoimmune-induced arthritis, such as rheumatoid arthritis. So for reduction of pain, and in the kids that they studied that had the rheumatoid, 80% of the kids had a reduction in pain and swelling just after 3 months worth of usage. That's a pretty substantial figure for an item that's less than $25 a month for a good dosage. So helpful consideration, particularly for children, I think. And I know, once again, this is something on a Dr. Lindbergh list we see sometimes coming in. And some other physicians, too, are recommending the type 2 I'm seeing coming in because the research is just so there. I think there was a recent study of it replacing some of the very hard-hitting drugs, methotrexate, for rheumatoid arthritis, that it competed with it and was more successful than methotrexate. So if you've got rheumatoid arthritis, you'll know what I'm saying when I give that name. MSM. Necessary for the building blocks of collagen, and that is our skin, our joints, our tendons and ligaments. And so it's a sulfur compound, so if you've got a sulfa drug sensitivity, it might be something you have to pursue with very carefully on a low dosage. But what it basically does is it promotes the detoxification of the body, particularly heavy metals. And then it's a sulfur compound. Sometimes we forget to look at the periodic table, and yes, you're hearing about it again, your high school chemistry. These different types of elements, minerals, that are on the periodic table, certain ones of them will bind and they'll take other ones out. Like, for example, silicon. It builds bone and connective tissue, but it will literally detoxify aluminum. And when you detoxify aluminum, aluminum causes Alzheimer's and inflammation. So once again, silicon is a mineral element. It binds and removes it. But if you have high amounts of aluminum, once again, it competes with silicon. So these types of minerals, once again, boron, we use that a lot for building bone, decreases pain. These minerals on the periodic table will bind to some of the toxic heavy metals and help remove them out of the body. SAMe, lots of studies on SAMe with depression, but there are also studies. 800 milligrams reduced pain significantly because it increases chondrocytes, cartilage cells actually in the joints themselves. It's very good for the liver, and it raises helps you metabolize the serotonin that you produce. So very helpful for arthritic types of pain and reduction. Last but not least, and I don't mean to put these last, it's only, I want to review the other things. There are so many good homeopathic medicines, such as like Arnica montana. If I ban myself, I'm doing Arnica in my mouth and Arnica gel. I mean, it really does help. Nux vomica. There are some real pain-relieving ones out there for nerve pain. You can look them up online specifically, or if you've got a homeopathic doctor, that are very helpful, that will help the body work within itself. It actually almost works on the theory of vaccines. So very safe, very effective, and can be taken with all medications. Most of these can. There's very few exceptions on here other than maybe some of the blood thinning properties of turmeric. You have to be mindful of that. I hope this helps. Once again, this is not a complete list, but it gives you a good idea about what we're going with and what's out there. Research. Next, we're going to be moving on to the fitness portion of the show. Thank you. Hi, welcome to the fitness portion of our show. And back by popular demand, I showed this exercise about a year ago, and I'm going to show it again because I had customer requests for it all week long, and I kind of thought, you know what, I'm going to show this one. This is for sciatica pain, and it can be very, very helpful. I was shown this exercise by a sports medicine doctor when I had chronic sciatica for about 2 years. And actually, it started happening to me again this week, naturally. And so I started doing the exercise again, and then I had customers asking for it, so here we go. What we do is we get in a 90-degree angle up against a wall, and obviously I don't have the benefit of a wall, so we're using a chair temporarily. What you do is you're going to push in with one leg into the wall fairly firmly, and then you're going to put your hand here, and you're going to resist like this. Okay, so I'm resisting here while I'm pushing here, and you're going to hold that like for 30 seconds, okay? Then you switch, do the same thing. Push up against the wall on the opposite leg, resist with the other section. You're going to do that for 2 or 3 sets for about 30 seconds at a time. I would say probably 2 to 3 times a day, and I think you're going to see some helpful release. That, and keep your magnesium levels to relax those muscles. Thank you, and next we're going to be moving on to the research portion of our show. Thanks. Hi, welcome to the research portion of our show, and with us today again is Ralph Tersh.
Thank you for that intro. What if I told you your 2 through 8-year-old child had the arteries or vascular system of a 45-year-old? Would you be concerned? Would you want to know why? Now, what if I told you that maybe as much as 1 in every 2 children do? Well, maybe not that extreme with the arterial system, but as far as chronic health conditions, yes. In the United States, according to the February 17th Journal of American Medical Association, 1 in every 2 children between the ages of 2 through 8 in the United States has a chronic health condition. Chronic health condition being defined as a condition that lasts for over a year. Now, a lot of these conditions can be type 1 diabetes, type 2 diabetes, ADD, obesity, allergies, you name it down the line. The good news is a lot of these conditions can be cursory, meaning they can go away after about a year or so. However, though, it does issue a major warning to the American public that something is wrong with our children. Are we being overdiagnosed for these diseases, or do they actually exist? In either case, that spurs that there is a problem. Never in history have 50% of children before the age of 8 begin to have chronic health conditions. We're not even talking 9 through 18, We're just talking 2 through 8. And again, basically they said, the doctor said in the studies that they already are like 45-year-olds in terms of the blood vessels' health. We need a basic change in how we live and how we eat. Prevention is the key. And when they looked at obesity, they only considered obesity the 95th percentile, which is an extremely high qualifier. So basically, the figure may even be more than that, and it can be pushed down a little conservatively because it begins to seem extreme. But this is the U.S. 1 and 2, February 17th, Journal of American Medical Association. I apologize. So we really got to start taking a look at the health of our kids. So please, start looking at what they eat and how much physical activity they get at the same time. Outside of that, a very common spice in India and China, and this was reported at St. Louis University. It's something called bitter melon. Well, what does bitter melon mean? And some people may recognize bitter melon as far as diabetic because bitter melon seems to help control blood sugars. But what does bitter melon mean to you, especially if you're a female? Well, they found out bitter melon attacks breast cancer cells. How effectively does it attack breast cancer cells? Well, let's take a quote from the article. Our result was encouraging. We have shown that bitter melon extract significantly induced death in breast cancer cells and decreased the growth and their spread. Sounds important. Now keep in mind though, this first test with bitter melon was done in vitro, meaning it was done in a test tube. So there's still a little bit of time to do some animal studies and human studies, provided they actually get the money and funding to do it. Unfortunately, there's usually not a lot of money in researching things which are available to everyone or that you can't patent. But it is promising. She also cautioned against seeing bitter melon extract as a miracle cure for breast cancer. Now, however, they said, cancer prevention by the use of a naturally occurring dietary substance is considered a practical approach to reduce the ever-increasing incidence of cancer. Studying a higher-risk breast cancer population where bitter melon is taken as a dietary product will be an important area of future research. Well, it shouldn't be future research. It should be research now. Very promising. Now, for all those green tea drinkers, well, you've probably been seeing things in the right light, at least when it comes to your eyes. They discovered that green tea has an incredible impact at protecting the vision. Now, this came out of basically the bi-weekly Journal of Agriculture and Food Chemistry. It should be coming out of other journals too shortly. Scientists have confirmed that the active components in green tea, specifically the catechins, do penetrate into the tissue of the eye. And they said, quote unquote, the so-called green tea catechins have been among a number of antioxidants thought capable of protecting the eye, including vitamin C, vitamin E, lutein, zeaxanthin. Until now, however, nobody knew if the catechins in green tea actually passed from the stomach, the gastrointestinal tract, into the tissue of the eye. Well, they now confirmed it did. They said the effects of green tea catechins, this is amazing, in reducing harmful oxidative stress in the eye lasted up to 20 hours. That means that that one glass of green tea you take in the morning is protecting you for a large portion of the day. Our results indicate that green tea consumption could benefit the eye against oxidative stress, which is great because now that goes in combination with lutein, vitamin A, bilberry, zeaxanthin. A lot of things can improve eye health. Green tea is a simple one. Glaucoma, cataract. If you're concerned about it, why not? It's simple and it beats soda, unless they carbonate it. All right, now for those. Now what if I told you, and I'm going to admit what the substance is in the first line. When they looked at animals with a ischemic stroke, they gave them a substance. Now imagine if this was in the Wall Street Journal or something like that. That showed, when they gave them the substance, grew new blood vessels in the brain, sprouted new nerve cells, and it greatly improved neurological outcome. You'd be buying stock in it by tomorrow, whether it be phase 1, phase 2, or phase 3 clinical studies. But you don't have to worry about that. It's available and it's cheap. It's something called vitamin B3 or niacin. And keep in mind, not too long ago, niacinamide was also shown to help with Alzheimer's. But since it's important, I'm going to read a few quotes from the article again. Again, I try to quote as much from the study as possible so I don't bias or prejudice it. They said, Dr. Chop's research found that in animals, niacin increased good cholesterol. Most of us know that about niacin, which increased blood vessels in the brain and axonal and dendritic growth, leading to a substantial improvement in neurological function. Niacin, this is quote unquote again, essentially rewires the brain, which has a very exciting potential for use in humans. The result of this study may also open other doors into neurological medicine, including brain injury. It says, if we are able to prove that treating patients with niacin helps to restore neurological function after stroke, we're opening a whole new avenue of treatment for leading causes of serious long-term disability in adults. This is a tool that you guys can use, something that's very non-toxic, easy to use. Keep in mind though, if you do try to use niacin on your own, and it's not no flush niacin or niacinamide, it does cause you to become red and patchy as it opens up the capillaries and make you feel itchy. So if you've never taken niacin before and you do, keep in mind you can get a flush. In fact, most likely you will. So keep the dosage low and increase it according to your tolerance. Now, back to why our children may not be as healthy as they may. Well, let's look at bisphenol A. At the University of Texas Medical Branch at Galveston, they discovered that BPA is leaking everywhere, and that damages the behavior, brain, prostate gland of fetuses, infants, and it includes young protein. But more so than ever, it causes asthma. What they did is they took animals and exposed them to BPA and then gave them egg album as they were developing, or egg white protein. All right, what they found is this. All 4 of their indicators for asthma showed up in the BPA group, much more than any other group that with no BPA. So their control group did not have the problem. They said, quote unquote, Cheryl Watson, the co-author of the study, described how adding small amounts of environmental estrogen, such as those in BPA, into cultures of human mast cells or mouse mast cells, common immune cells packed with allergic response, including chemicals such as histamine, produce a sudden release of allergy-promoting substances. I'm going to rush through this because another one on BPA, and that's according to children growing up, either in plastic bottles or pregnant women. They found out that this BPA caused you hypersensitivity to estrogens themselves, leading to everything to fertility problems, advanced puberty, altered mammary development, and reproductive function. That out of Yale University itself. This gives you correlating information between 2 different studies. If you're pregnant or have a child, get BPA out of their diet. And thank you very much.
Absolutely. Thank you, Ralph. Remember, keep the plastics down and use more ceramics and glass. Thank you very much for joining our show. Research, find out for yourself. Thank you.